I think a big part of medicine altogether was just kind of family influence. My mom's a nurse and stepdad's a surgeon. A lot of family members in medicine, not necessarily doctors, but a lot of nurses, physical therapy, and stuff like that. And, um, it's just kind of one of those things that kind of just thought you just kind of knew that it was for you. And surgery came about too. I wasn't really 100% sure I knew what I was going into for when I was going to medical school. And again, so it wasn't really until I started doing neuropathology, neuroanatomy that I really kind of fell in love with it. And what reinforced it a lot was just doing research right away. I mean, I did. So deep brain stimulation, the way it works so generally for the most part, it's people with movement disorders, so either Parkinson's or dystonia, which where they're very rigid, or something called essential tremor. So really, disorders in movement. So what we do is we can place using kind of a 3D reconstruction of the brain. We place a lead or a wire with 4 different contacts into the brain, and we can sort of access those different circuits. And in a lot of ways, we can actually alleviate their pathology. We can take away for Parkinson's patients. We can significantly reduce the amount of tremor that they have, and loosen their joints a little bit so they can function a little bit better from day to day. Dystonia, the same thing. We can reduce that tension that they have in their muscles. Tremors, same thing. Reduce the amount of tremors. We're at the point where they can feel a little bit more normal. They can feed themselves. They can change themselves and that sort of thing. So I think the main thing is I think a lot of people have a hard time figuring it out, and I think the best way to kind of deal with it is just just figure out if you want to do a surgical specialty or not, because it's the track is very, very different. If you like neurosciences, that's great, but figure out if you want to do neurosurgery or neurology, or somewhere in between. Oftentimes, what happens is people go into their 3rd and 4th year and they have no idea, and it really it becomes kind of a hard thing to try to do neurosurgery when it's kind of late in the